The first thing people need to remember is that they're already an advocate. They do it every day for their patients, at the patient level, at the hospital level, but we need to do more than just do it within the hospital and our offices. We have to do it with those that make the decisions that affect our ability to practice and take care of patients. If we're not there advocating for our patients and our profession, people who don't know how we work will make decisions on our behalf. We are the best people to say what is best for surgical quality, for surgical care, how it should be done. So we need to be in those rooms with those decision makers to make sure that that still occurs.
Surgical health policy advocacy is absolutely critical to our profession as surgeons, but most importantly, it affects patients and the care that we provide them, including the entire system of care. So I can take care of one patient at a time, taking out an appendix, addressing an operative problem. However, when I engage in advocacy at the state, national, or any other level, I can affect the care of patients on a much broader scale and effectively take care of patients in the tens, hundreds, thousands, even millions of patients.
The successes that I've had as an advocate have run the spectrum of American College of Surgeons' legislative priorities. Been really proud in our ability to improve the practice of surgery, to improve safety and quality for patients, to strengthen the delivery of emergency surgical care, to promote firearm safety, to enhance tobacco control, and most recently with colleagues up and down the state, to promote Stop the Bleed opportunities within schools and office spaces throughout the state of California.
I know it's cliche where people talk about, if you're not at the table, then you're on the menu, but it's so true. It is very important that surgeons participate in all the decisions in and around healthcare because we're the ones that are helping to take care of patients. So these decisions affect us directly, so we need to be a part of that conversation.
Advocacy is important, and it's really hard for surgeons. It's hard because we're used to getting our way. It's our operating room. You go into the operating room, things work the way that you want to work, and advocacy is the complete opposite of that. You get an occasional small victory here or there, a compromise that helps you along the way, and it's a long-term game, and it's about building relationships. And so we have a problem with understanding that and getting involved. But the only way that we're really going to get our agenda, help our patients in the long term in healthcare financing and economics, is to really be engaged with this advocacy. Talking to your Congress people, writing letters, being involved in all of the various quality campaigns and things that we do is something that every surgeon really has to be involved. You can't just have a handful of people in leadership doing this. You need the entire organization.